I am Sai Sudarsan. I am the consultant neurosurgeon in this hospital. I finished my schooling and my medical school training from Tirupati. I graduated from Sri Venkateswara Medical College. Then I went to Kurnool Medical College for my MS General Surgery. After that I worked for about a couple of years as a general surgeon. Then I developed some interest in neurosurgery, and then I went for my higher training in neurosurgery at the Sri Chitra Tirunal Institute of Medical Sciences, Trivandrum, an Apex Institute in South Asia for neurosurgical work. Since then I have been practicing for the past 20 years as a consultant neurosurgeon. My chief area of interest is neurovascular surgery, and I am the only surgeon in both Telangana and Andhra Pradesh states who can do both procedures like open microsurgery for cerebrovascular disorders as well as endovascular neurosurgery. I do both of them without any bias, where we can decide which person needs which sort of a treatment. My other areas of interest in neurosurgery is lumbar spine, where we at Star Hospital started for the first time a procedure called percutaneous endoscopic lumbar discectomy, where through a small hole, a keyhole from the flank, we access the disc pathology in particular, and we remove the pressure on the nerve at that level. We also use laser and radio frequency to aid our procedure. The entire procedure of PELD is done with the patient fully awake and aware, and we will be talking with the patient during the entire procedure. Thereby we can minimize the complications due to a back surgery, and the patient is made to walk out of the theatre immediately after surgery, and he can go back home the same day. In layman's term, we call it as a band-aid surgery. Other areas of interest for me in neurosurgery are skull base and CV junction. Coming to the Star Hospital Institute of Neurosciences, we work as a team here with 3 people. I head the department and 2 of my colleagues join me in their work. Ours is a dedicated neurosurgical center with a state-of-art theatre equipped with everything like a very good high-end operative microscope, CUSA, 2 craniotomes, pneumatic drills, intraoperative monitoring for awake surgery and epilepsy surgery, and endoscope for nasal approaches for pituitary tumors, CSF rhinorias and anterior skull base tumors, and laser and RF lesions for our endoscopic lumbar discectomy. We have a dedicated ICU, critical care for post-op management of neurosurgical patients and neurology patients also. We work round the clock, 7 into 24 and 365 days, and it's a teamwork here. All 3 of us take part in the decision making as well as the post-op management and the post-op plan also. Proud to say that this is one of the very few centers in the country where the teamwork is given utmost importance. We interact with the neurology department in decision making for epilepsy surgeries, in stroke management, acute management of stroke like intra-arterial thrombolysis, intra-arterial clot retrieval, treatment for normal pressure hydrocephalus and other things. Compared to the other hospitals, Star Institute of Neurosciences is unique in, I can tell, in 2 specialties, 2 subspecialties. One is endoscopic lumbar discectomy, which no other center is doing apart from our center. The other thing is a neurovascular surgery, where I give the treatment both endovascular as well as open microsurgery. Many centers, the endovascular surgery is done by a radiologist, and the neurovascular surgery, the open microvascular surgery is done by the neurosurgeons. So there may be some clash sometimes, some differences in the management thought process and all. All those things are circumvented in our center because both the procedures are done by our department. We can take a decision without any bias, tailored to the needs of the patient.